Hello, everybody. My name is Juana Saucedo, and I will be talking about orgasmic disorder. Orgasmic disorder affects both men and women. Orgasmic dysfunction is a condition that occurs when someone has difficulty reaching orgasm, even when they're sexually aroused and there's sufficient sexual stimulation. Male orgasmic disorder may be defined as a persistent or recurring inability to achieve orgasm despite the lengthy sexual contact or while participating in sexual intercourse. Many women have difficulty reaching orgasm with their partner, even after ample sexual stimulation. Orgasm disorder affects approximately 1 in 3 women. Orgasmic dysfunction is also known as anorgasmia. Some of the physical causes of anorgasmia are medical disease, gynecologic issues, medication, alcohol and smoking, aging process, injury or damage to the blood vessels located in the genital area. Medical disease, any illness that can affect the part of the human sexual response cycle, including diabetes or neurological disease such as multiple sclerosis. Gynecologic issues. Orgasms may be affected by gynecologic surgeries such as hysterectomy or cancer surgeries. In addition, lack of orgasm often goes hand in hand with other sexual concerns such as uncomfortable or painful intercourse. Alcohol and smoking. Too much alcohol can cramp the ability to climax. Same applies to smoking, which can limit the blood flow. The aging process. As female ages, normal changes in the female anatomy, hormones, neurological system, and circulatory system can affect their sexuality. A tapering of estrogen levels during the transition of menopause can decrease blood flow to the vagina and clitoris, which can delay or stop orgasm entirely. The psychological causes of the disorder are mental health problems such as anxiety or depression, low self-esteem, stress and financial pressures, cultural or religious beliefs, fear of pregnancy or sexual transmitted infection, embarrassment, lack of communication, or unresolved conflict with a partner, past sexual or emotional abuse. Treatments for orgasmic disorder are have a healthy attitude towards sex and education about sexual stimulation and response, quit smoking, limit alcohol consumption, get plenty of rest, discuss with your doctor any medical problems such as diabetes or sclerosis, any new medicines, and menopausal symptoms, hormone therapy, and masturbation. Premature and retrograde ejaculation. Premature ejaculation affects both men and women. Premature ejaculation is uncontrolled ejaculation either before or shortly after sexual penetration. It is the most common sexual dysfunction among men. According to a study conducted in the University of Chicago, nearly 10% of women have felt that they had reached orgasms too quickly. According to WebMD, most cases of premature ejaculation do not have a clear cause, and men often learn to delay orgasms. Retrograde ejaculation occurs when semen enters the bladder instead of emerging through the penis during the orgasms, and retrograde ejaculation only occurs in men. Treatment for premature ejaculation and retrograde ejaculation is slowing down the pace of intercourse, masturbating prior to intercourse, use desensitizing cream, use a thicker condom, therapy. For retrograde ejaculation, typically does not require treatment unless it interferes with fertility. In such cases, treatment depends on underlying cause. Medication can help with the retrograde ejaculation and need to restore fertility.
When it comes to treating premature ejaculation, I would say first and foremost, you need to relax. Oftentimes, even if there is sort of a reflex where you don't need as much stimulation to reach your point of orgasm, it's also true that chances are you're feeling nervous or anxious or really don't want that to happen, and that pressure that you're putting on yourself is getting in the way of you having the ejaculatory control that you're looking for. So take a deep breath, relax, and realize it's about learning what we call the premonitory sensations. And by that I mean, when you're getting sexually aroused, most men are focused on the sensations in their penis. But you also have to notice what's happening to your breathing, whether or not you might be tightening in your legs, your buttocks, your feet, What other indicators do you have that basically you're no longer in what I consider your safe zone? And by that I mean you're aroused and erect, but you're not approaching what I call that point of inevitability or that point of no return. So learning what is your safe zone and on your own with masturbation, learning exercises that you can last 5 or 10 minutes is one of the first techniques that you often would do working with a sex therapist. So some of your treatment options are learning those premonitory sensations. You can also use desensitizing creams, or many clients use condoms because they like the fact that it cuts some of the sensation and stimulation. And you could also speak to your urologist or doctor about the potential role of medications. There are some off-label use of medications that are known to delay ejaculation, and sometimes they may be used as an effective treatment. I really want you to realize that if you can relax and let go and have a partner who's willing to sort of slow things down to help you realize what is that safe zone, that you're going to have really enjoyable sexual experiences.